Joe Wren. It's been more than a year since the town of Austin was catapulted into the international spotlight. The community was ground zero for an HIV epidemic. Since the outbreak was first reported in February of 2015, the number of HIV cases has swelled to more than 180. Most cases have been traced to injection drug use and needle sharing. Indiana lawmakers changed the law last year to allow Scott County to establish a temporary needle exchange. But as Sarah Whitmire reports, health officials are worried the programs might not be sustainable.
Since Scott County got approval to create its needle exchange program, about 24 other counties have also started down the process, including here in Monroe. In very simple terms, needle exchanges allow drug users to turn in old needles for new ones.
So when people come on that actually want access to needles or testing, they'll come here for it first, and they put their dirty needles in here. And then we have postcards here that show various techniques of good vein care.
About a half dozen exchanges have gotten state approval since the HIV outbreak in Scott County. They're all a little bit different. Monroe County's is the only one that contracts with an outside provider. The county health department oversees the program and is responsible to the state. But Chris Abert, who is the founder of the Indiana Recovery Alliance, actually provides the services through his mobile unit. Abert is a former addict, and all of his staff are either current or former users. They focus on what Abert calls comprehensive harm reduction. Access to syringes is actually a relatively small part of what they do.
So we have basic toiletries here. We have safer use guides, FAQs about the needle exchange, the paperwork that we do for how many in, how many out, tampons and condoms and lubrication, and then a variety of syringes, individual water packs, cottons, some sterile safety squares, tourniquets, cookers, and a variety of biohazard containers. We continued to give out blankets and jackets. We're going to do a sock exchange. Right now we're just giving out socks, not asking people for their old socks in exchange yet. Doing referrals to treatment, mental health referrals, housing referrals, and working with participants to empower them so that they can also begin to show up for meetings where their fate is being decided.
And before you exit the van, there's a chance for you to leave ideas for other services or needs you might have. This comprehensive harm reduction approach is about acknowledging drug users typically have a lot of underlying issues. Carrie Lawrence is with the Rural Aid Center, and she says that's been an important takeaway from the HIV epidemic.
From my perspective, as far as the outbreak, we have seen over time a lot of the social determinants that sometimes facilitate some of these health-related emergencies, extreme poverty, low socioeconomic status, low literacy, not access to public health resources, not even access to mental health and addiction, and that's an ongoing problem.
Studies show the exchange programs are effective at reducing the spread of diseases such as HIV and hepatitis C among IV drug users. But it's too early to say whether the needle exchange programs in Indiana are working. The mobile unit in Monroe County has only been operating about a month. Abert estimates they've probably served about 100 people, but the health department can't provide specific data yet.
I think it's going great so far. We've already got a lot more participants than some of the other counties they had when they started. We're getting a lot of new participants, which means word of mouth is spreading and people are learning about the service. So, it's starting slow, but still I think it's really strong.
The way Indiana's law is written, a county has to reapply every year to continue to operate an exchange program. The State Department of Health determines the process for counties to use if they elect to renew their request to operate a syringe exchange program. But those guidelines outlining the process haven't been established. The health department says that's coming soon.
It was the same for starting the syringe exchange. Again, people don't have answers yet. So it was not only daunting but frustrating.
The big unanswered question is if the rates of hepatitis C and HIV improve, will the state renew the county's needle exchange programs? One of the criteria counties have to meet is they have to show they have an epidemic of HIV or hepatitis C, and they have to show it's caused by intravenous drug use. So, in effect, if they're able to be successful and eliminate the epidemic, that could spell their program's demise. Joe, back to you.
And there are a lot of other details to work out too, among them funding. Monroe County has cobbled together many resources to get its program off the ground, but it's still looking for more money. Scott County's funding is running out, so they're trying to find a new source. Chris Abert says everybody is making it up as they go because there's no standard in Indiana yet for what a needle exchange should look like. Now, for headlines, we go over to Barbara Brozier, who has the latest on this week's top stories.
Thanks, Joe.